I would like to introduce to you JennaRose. JennaRose Dahl has a graduate certificate in teaching adult ESL. She is the Digital Literacy and Distance Learning Instructor at the Minnesota Literacy Council, where she teaches blended learning ESL classes, and she is also the service specialist and trainer for the Northstar Digital Literacy Assessment. Her BA is in English literature and writing from Bethel University, and her graduate certificate is in teaching adult ESL from Hamline University. So welcome, JennaRose.
All right, thank you. So going over our agenda for today, we're going to go over the importance of digital literacy skills, especially as they relate to a healthcare context. I'm going to go over the context and uses of what the Northstar Digital Literacy Assessment is. So just quick show of hands, has anyone in here heard of the Northstar Digital Literacy Assessment before? Okay, a couple, but it's new for most of you. That's awesome. I'm going to tell you about our new updates for version 2.0. So we just went through a big update this last year. Give you information if you want to become a proctoring site. And then we're going to discuss some key skills that would appear in a new Northstar Health Literacy module. So first, just take one short minute, turn to the person next to you, and share about the last time you learned a new computer skill. All right, so let's come back together again. So this is my computer lab in St. Paul. So I've been working for the Minnesota Literacy Council for about 8 years, and the first 5 years or so we're working with unemployed adults who had been laid off from their jobs and didn't have computer skills, so they weren't able to actually apply for a new job. They'd maybe had the same job for 20 years, then were put on unemployment, and weren't actually able to apply for a new job because the world had changed since the last time they'd applied for a job. So these are some former students who came in to learn computer skills, everything from the basics of holding a mouse, doing something online, and the more and more advanced we get with computer skills, the easier it is to just Google the answer that you want or look it up. But if you lack the skills to actually know what a web browser is and get online, you're not able to look anything like that up. So these are some examples of different barriers that people face in terms of digital literacy. So there's that access barrier. And I know in parts of rural Minnesota, rural Wisconsin, there's access barriers to technology, to high-speed internet. I grew up in the middle of the woods in Minnesota on a dirt road, and we didn't have a computer in my house growing up. So the first time I used a computer really was in college. And that was a huge disadvantage to me. I didn't know how to do any online research. I couldn't type up a paper. If I did, it was very slow. I remember calling friends to ask them how to get information from the internet into this paper. So I had instructions verbally on how to copy and paste. It was really, really challenging. There's also a taste barrier. So maybe you're lacking the confidence or experience to be able to use a computer. And then that readiness barrier where you're lacking those basic skills that you need. So maybe you've got a taste for it. You've realized you can look up your favorite music or apply for jobs or communicate with a relative in another state. You've got the taste for it, but you don't have the skills to do that. So here's a couple of stats about digital literacy barriers, but mainly what I want to drive home is that the lack of technology literacy, digital literacy, is a huge barrier in many different aspects of people's lives. So as educators, as healthcare practitioners, we typically have higher technology skills, but there are lots of people, about 24% of folks in America have low technology skills, and that is a barrier to them. So how are people with low digital literacy skills disadvantaged in healthcare? So just take a few seconds and think, jot down any ideas that you have of someone entering the healthcare field or a patient. How would low technology skills be a disadvantage to them? So some ideas that I came up with, I'm a Minnesota literacy person, so I work with English language learners, new immigrants and refugees, people who need a GED, So thinking about things that they couldn't access, like an online portal. They can't communicate with their doctor online. They can't schedule an appointment online. They're struggling with things like insurance. I just signed up for the Y and I had to submit my fitness reimbursement form online. There wasn't a paper version, so that would have been a disadvantage to me, a monthly fee. Billing, giving feedback forms, so I know when I've had medical appointments, I'm able to fill out a feedback form through my email. Doing things like online research, so if I have symptoms that I want to check, should I go into the hospital or not? I always look them up online. But if you don't have technology access or technology skills, you're not able to do that. And determining the validity of online information. So one assessment that we have is about information literacy. So this is about being able to navigate the internet and determine what is actually valid information and kind of processing through that information. So that's a higher level thinking skill. And if you don't have digital literacy skills, like my dad thinks everything he reads on the computer is definitely true, right? So that idea. Getting into a little bit, what is Northstar? So Northstar Digital Literacy Assessment is a series of online guided modules to assess basic computer skills. So anyone can go to our website, it's Digital Literacy Assessment, and you can take these assessments for free. When you take these assessments, they're usually about 30 questions long each, then you get a printout that shows this is what you've mastered and this is what you need to improve. So in my context, working with unemployed adults, I would have them take our first assessment, which is basic computer skills, and that tests things like whether they know how to copy and paste, or double click, or drag and drop, all things that you might have to do when you're accessing healthcare services online. When they finished, if they scored 85% or higher, they would get a certificate. If they scored lower, they would get that printout that showed this is what you know, this is what you need to work on. So then I was able to target instruction with them. So if there were 5 things that they needed help with, I could set them up with a tutor to study those things to become more digitally literate. That certificate allows individuals to demonstrate competency, and it assists with job search. So when they get a certificate, that's something they can add to their resume. It also really helps with overall confidence because when you're looking at something like English language learning or getting your GED, those things take a long time. And comparatively, learning digital literacy skills actually happens pretty quickly. Teaching someone how to go online and Google something is much easier than teaching someone a full language. So these are the modules that we currently have. The Minnesota Literacy Council and the St. Paul Library System started Northstar back in about 2012. And we started with maybe the first 5 modules, and we've been adding on since. Currently in development are one on career search skills and digital footprint. The next one we'd like to make is either one on Google Apps, like Google Docs, Google Slides, or one on health literacy. So I want to talk to you guys about that one today. So yeah, the Northstar assessments, you can use them as a pre or post test, which can be really great when you're working with people and you want to show where they're starting out from and where they're ending up. Coming up in the summer, probably in June or July, we're going to release curriculum that aligns with 3 of our modules. So computer basics, internet basics, and career search skills. So that will be a teacher-led curriculum to teach these digital literacy skills. And coming up in the future after that, we're going to develop a learner management system. So people who are learning digital literacy skills can take an assessment, and then if there's 5 things they missed, they can go online and study those things with activities, games, resources. So that may be a better fit for multi-level classes, for people who are studying at a distance. And then the certificate is optional. The assessments have audio. So for each question, they'll read the question out loud to you. They also write it on the screen. We have closed captioning, and it is ADA compliant. If anyone becomes a testing center, you get an online database, so you can keep a record of everyone's test scores. So this is used in contexts like adult basic education, in community colleges, in corrections, and also in workplaces. So now employers are using this to assess their employees' digital literacy skills and track those things also. This is an example of what the certificate looks like. So when someone passes assessments, you can list each one that they've passed on the certificate. In my computer lab, I didn't have a fancy color printer, so I always printed the certificates on cardstock to make them feel better. The certificate is awarded through testing locations, so the Northstar assessment has really grown as a project. It started out as a small St. Paul project, but now these certificates are offered in all 50 states, in Canada, in South Africa, in New Zealand, in the UK. It's really rapidly grown, so over 600 places are offering the certificates now. I think as of maybe this last week, it was about 660. That certificate can be added to resumes. It provides proof to employers that someone has digital literacy skills, and it really validates digital literacy skills. And then we just went through an upgrade to version 2.0. So we have a new website. We've updated each of our assessments, including revising all of the standards. So the standards that we use to drive the assessments and instruction are revised through a community-based process. And that's why I want to talk to you today about creating standards for health literacy. I want to get your expertise in on this one. When we updated the modules, we switched to using HTML5 technology, which gives us a lot more flexibility in how folks answer questions. So the question will act really much more like an actual computer. If we're asking them to do something in Microsoft Word, it will act like it should. Another change we made was that for test locations that offer the certificate, everyone has an individual account. Previously, there had been like one main account. Now everyone can log in with their email address and password. This is a picture of our new website and the admin portal, which you have access to if you are a testing location. Will have a list of all of the assessments taken at your site, so you can track that data, manage that info, and then there's also a help section with a lot of online resources. So we wrote a manual, we have short videos, our support email, all of that stuff is included with testing locations. Our new assessments, this is an example of what one of the questions looks like. So this is in our first assessment. So it's asking you to click on the desktop computer. And then once someone clicks on one of these options, it'll progress to the next question. So this is like our very basic level. This is an example of our results page. So once you finish an assessment, you can print out this results page. It'll show the skills that you've mastered and what needs improvement. So we use those standards on this results page. So essentially when we write a standard like define a problem, formulate a question, or identify a decision that needs to be made, we'll write a question that reflects that or matches with that standard, sometimes 3 or 4 questions. And then coming soon, that learner management system will hopefully be launched in 2020. So that's where anyone will be able to log in and learn digital literacy skills that align with these standards. So there'll be things like games, videos, articles, ways for people to learn these technology skills independently. And then the curriculum for teachers and tutors, the first 3 are coming out in July. Those new modules we've kind of already discussed. For testing locations, they pay an annual fee. Usually it's about $500 if you're maybe a nonprofit agency that has 3 computer labs that you're going to be using this in. I think it's about $1,200 if you're something like a community college with multiple branches. And then we also have the ability to network sites. So if a state buys a license, we can have a state administrator that is able to run reports and get data from all of the assessments taken in the state. Here are just some usage stats. So like I said, this is really like a small St. Paul project. There's pretty much 5 of us working on this team. At this point, over 3 million assessments have been taken worldwide. Many were at test locations. We also have online badges, so for people who don't want the paper certificate, they can claim an online version. For a health literacy module, next I want to spend some time discussing what you would like to see in a future module based on health literacy. Think about what computer skills are most important for people to have as they navigate healthcare. What do you see people struggle with in terms of computer skills in your field? So first, just take a minute to think about those 2 ideas.
The Northstar Digital Literacy Assessments were created to assess computer skills. In 2010, the St. Paul Public Library and the St. Paul Community Literacy Consortium in St. Paul, Minnesota, began a community-based process to define the skills needed to thrive in today's technological world, and the project has been growing rapidly ever since. Now anyone can take an assessment for free at digitalliteracyassessment.org. When you finish an assessment, you get a results page showing what skills you've mastered and what skills need improvement. If you'd like to show others what you know, you can take an assessment at a testing location under proctor supervision. Then, if you score 85% or higher, you'll earn a certificate. The Northstar certificates demonstrate that you have computer skills. You can show your certificates to employers or list them on your resume. There are over 500 testing locations, and assessments have been taken over 3 million times.
So, that video we made maybe 5 months ago, and we said we had about 500 testing locations. Now we're about 660, so it's continuing to grow really, really rapidly. The other thing I want to show you before we get into this discussion is a bit on our website. So our website here, again, digitalliteracyassessment.org, is where anyone can go and take an assessment. So if I go take an assessment, it's going to bring me down to each of these different assessments. The ones that are updated are the ones that we've already transitioned to HTML5, so that's something that we're continuing to work on this year. And then the 2 new ones that are coming, career search skills, that one's in beta testing right now, so testing locations can try that one out and give us feedback. And the one on digital footprint right now, I just did a photo shoot for it on Monday. We're taking photos of like students and volunteers to act as characters in the module. So we're trying to get a diverse range of people in those modules. I want to open up one of these assessments and show you what these look like. So for example, internet basics, which I think is going to be a huge factor.
Let's take a minute to look at how this assessment works. If you're familiar with these assessments and you're confident you know how they work, you can click Skip Orientation at the bottom of the screen to begin the assessment. This assessment has many questions. You can have as much time as you need, so answer each one carefully. When a question loads, you will hear audio telling you what to do.
So we have basically a 4-minute introduction to what the assessments are for people taking the assessments. It'll kind of guide them through how to do that. I'm going to skip past that orientation and start the assessment.
Select all of the internet browser icons. Then click Next.
So this is going to be related to a standard about internet browsers. So we want people to know how they can get online, what different browsers are. So here I can select different browsers and click Next.
Select 3 ways you can connect to the internet. Then click Next.
So if I answer some of these questions and go Next, it's going to tell me I need 3.
In the picture, click on the button in the browser window that takes you back to the last page you were on.
If I answer a question incorrectly, if I decide I want to change my answer, I can come up here to view other questions and I can go back and re-answer that question. It's going to tell me whether or not I've answered it, not whether or not it's correct. And then at the end of an assessment like this, I would get that results page. So anyone taking the assessment for free can get access to that results page. It's just at testing locations that you would also get a certificate if you scored 85% or higher. All right. It also will show in the assessment whether it's the public version or whether it's at a proctoring site. So if you are offering this to employees or to students, it will show you whether or not this is eligible for a certificate. The closed captioning is right here. You can adjust the sound, you can make it full screen, you can replay the audio for each question, but we've designed a really new, fresh and simple interface for these questions. So all of these questions are coming from our Northstar Digital Literacy Standards, and you can find these on our website. So if you go to digitalliteracyassessment.org, you'll want to click on Assessment Info, and then if you scroll down, you can click on Standards, and we've got those available in a PDF. So these can be used to inform instruction. They're also what we use to develop our curriculum and assessments. So for each assessment, we'll have usually between like 12 and 20 standards. I'm struggling with scrolling. These are my digital literacy skills on a new computer. Okay. So standards for basic computer skills, for internet basics, email. We've got one for Windows, one for Mac, for Microsoft Word. And then some of the more challenging ones I want to show you, like information literacy, will have things like demonstrate use of efficient search strategies to hone in on relevant information. So when I envision a health literacy module, I imagine it being more at this level of information literacy versus being at a level of basic computer skills. So we don't need to test whether people can double click. But what skills would you see, that are similar to these that would specifically align with health literacy? So coming back here, what computer skills are most important for people to have as they navigate healthcare? What do you see people struggle with in terms of computer skills in your field? So first, for introverts in the room, just take a minute to think, jot down your answers before we discuss this together. All right, so I'm glad this is generating a lot of conversation. Does anyone want to share some of the ideas that you had, some things that came to mind with these questions?
Yeah, when you were talking about this, what would be really great is to have instruction on accessing your online health portal.
Right.
Mm-hmm. And that's not real literacy related, but people who do not navigate to that a lot, it would be a great thing to have.
Right, so having instruction on how to navigate to an online health portal, along with also that assessment piece, validating that people do know how to do those things. Yeah, awesome.
And setting up the account for it. That's actually the
biggest barrier. Right, so how to actually set up that account, which will also require probably an email address, which is another barrier for people who have no technology skills. Yeah.
We have an online portal that we strongly recommend people subscribe to and use. And it is difficult. I work as a patient education librarian, and so I run into oftentimes people don't understand the difference between a username and a password when they're trying to set up an account. I also run into, Annette and I were just talking, people have trouble with scrolling.
Right.
Particularly if they've got some sort of a health issue, like maybe they've had a stroke, so their motor control problems are going on, they can't handle a mouse, or there's a spasticity issue, something like that. So how do people learn to cope with those things?
Right. So both those ideas of being able to differentiate between a username and password, that's a big one. I've also worked with students who, once I give them a username and password for email, they think that's their username and password for everything. So they think, oh, I can use this to log into any website, and then they get really overwhelmed when they find themselves with so many more. And then that idea of mobility or ability playing into how they access technology. So with a lot of patients, if they're dealing with disability, struggling to use a mouse. I know one of my volunteers in my computer lab was a quadriplegic, so he was always really great at working with students who had ability issues. And we, rigged up a keyboard, plugged it into a USB in other computers so he could use his keyboard from his wheelchair to, work with students. So there are definitely ways around those things. But if you don't have that information, that would be really challenging.
Yeah. So we have found that we actually give people an account information sheet on paper because they don't remember the email. They don't remember their username, password, or even what they signed up for or what they did. And so having that paper-based resource to help them recall is really helpful, and it helps them be able to get back in at a later date.
Right, right. That tangible paper proof that people have an account with all of those steps can be really, really valuable when
Also really helps other people to help them.
yeah, absolutely. Though I have seen even technology teachers like print out an email I sent them, and I have to be like, yeah, it's there. It's in your email. Yeah.
Related to that, making sure login information matches with the audience. We have a system geared towards low-income people seeking healthcare, and the password, the questions, if you get locked out of it, are the general standard default questions, like what street did you grow up on, what was your first job, and they found that a lot of people struggled with answering those questions because if you live many different places,
Right.
or what do you mean by first job? Like when I babysat or when so making those questions much more specific. There was like a whole list of them. Oh yeah, this one applies. This one applies.
Right.
So then there's a struggle of I won't even answer these questions and get into my account because I don't remember. I don't even know how to answer them to set them up, first of all, or I don't remember my answers from a year ago.
Right. So those kind of security questions when you log into an account can be a barrier. Right. So if you don't, I know I've struggled to answer some of them because I grew up in the woods, and then when I think of, a lot of my students are refugees, what street did they grow up on? Like they were, somewhere in Somalia traveling.
Or like what is your mother's maiden name in a lot of cultures, or is it that type of,
Right. So
it don't fit.
Just like a diversity issue when it comes to those security questions too. Yeah. Yeah.
I think basic terminology, it's a problem with health literacy, but when you get to digital health literacy, you need to have some basic terminology, glossary, like online health, go to your online health portal. Right there, you got a barrier.
Right, so that's, like a vocabulary issue, not knowing the terminology. What is an online health portal? What does that mean for me? Awesome ideas. So
That is like symbols, like some of the basic symbols on a word or whatever. They're making assumptions that you know what that little button says or means.
right,
So a glossary, which includes words, but also the symbol glossary.
the symbols that you'll find in those online portals, like I know a lot of people struggle with, some people call it a hamburger menu. It's those 3 lines, right, that mean this is a menu, but people don't realize that that means anything. That was made by a developer a while ago without thinking of people with low technology skills or what that actually implies. Awesome. So next, I want to take a little bit of time. Everyone can whip out their phones or computers and go to this website. It's padlet.com/jdahl8/Northstar, and I'm going to pull it up here. So this is a spot where you can type up those ideas that you've been generating. So everyone can type their ideas here at once, and they're going to appear. So if I said something like symbols in healthcare portals, I can just post that and it's going to show up here as an idea. You can put your name on it or you can make it anonymous. And then you can heart it if you think that that's something we need to look at when we're designing this module. So again, that URL is padlet.com/jdahl8/Northstar. And once you get there, you can just start adding those ideas we've been generating. How to vet health information websites. That is a huge one. Like I said, my dad really does believe everything he reads online, usually on conservative websites, but also in we think we should go on an all-bean diet. That's going to be the most healthful thing. I read this article about it. Online payments, yep. And how to opt in versus opt out. I know I've had so many students really, really struggle with getting hundreds and hundreds of emails that they don't want, and they don't know how to unsubscribe from that kind of information. They don't make it easy. I mean, that's the fault with technology, is that it's designed by people. It really can't be perfect.
Well, and I'm actually not able to even get onto this for whatever reason, but I did want to mention something that we were talking about.
Sure.
And half jokingly is even just where to find a phone number to call somebody. Like if you're going to your health insurance
just type
website,
in
we're
that
talking about how often health
thing
insurance
into the
websites,
browser.
they're all different, but they'll have different tabs. They'll have for members, and people may not know, oh, I'm a member.
Right.
What the heck does that mean?
What's facility?
Yeah, like what is a facility? And so just how to find the phone number to call somebody to talk to a real person.
Right. So that's like vocabulary like facility or member that people would struggle with. And then I struggle with finding a phone number sometimes. They on purpose make it hard.
They don't want you to call.
Exactly.
And
So
even, like how to navigate when you say, like what's an FAQ? If you go there and then they say, like, how do you get through all the mess of still not finding your, they'll try to prevent you from calling.
Right.
So how do you find that phone number or even an email address to actually talk to somebody?
Absolutely. And FAQ, that's another kind of vocabulary thing that we really only use online. So for someone who's tech savvy, that makes sense. It's an FAQ. For folks who are really new to digital literacy, okay, that's an abbreviation of something, but it doesn't necessarily look helpful. Yes, telehealth stuff. That's something I'm newly learning about. These are really, really awesome ideas. How to email or attach a document. That is another huge one when you're communicating with folks about healthcare. And using a webcam, I've been seeing, I've done maybe one visit with my doctor over my laptop, and I found it so helpful when you're feeling kind of sick and miserable. You know what your issue is. You know you just need a prescription, and you don't want to like make an appointment and sit in a waiting room and do all that stuff because you feel really crummy. So having the benefit of being able to do an appointment online can be really, really helpful.
Or that I email my physician and request renewals and stuff. It's just so convenient. You don't need to go in and
Absolutely.
through the portal.
Right. So that's saving you time to be able to email your provider about, short questions or prescriptions or any of those things. If you don't have that access or technology skills, that's a disadvantage to you. Awesome. Yeah. Advocating to IT designers to simplify these systems is a big one. I think, web design. I get mad with a lot of websites, and I mean, working for years with folks who are unemployed, helping them apply for jobs. Every job application was different. Every step that they had to take was different. So you can't just teach someone, how to get through this one application. You need broader digital literacy skills to navigate all of these different websites. And real problem-solving skills to know how you're going to accomplish the task that you need to. Okay, these are really great. So you can add things here at any point. So if you think of something later today, feel free to add this here. Again, it's padlet.com/jdahl8/Northstar. And then we've got about 15 minutes left, so I'd just like to have time for questions if anyone has any questions about Northstar.
You may have said this in the beginning, but in particular working with seniors, not just people looking for jobs or English language learners, do you have any experience using this with seniors, and is that different than what you've seen with other populations? That's an area that I work with a lot in health information.
Right.
Sort of the common thought is they won't use it, and that doesn't seem to be true. Sometimes they have a family member or something, and then we have some seniors who are super savvy, but just wonder what your experience is using this with that.
Right. So I mainly worked with seniors initially that first 5 years when I was working in that computer lab with unemployed folks. So it was mainly older folks coming in. No, there was a range. There were some more middle-aged folks who were looking for employment, but there were also people coming from senior centers. And yeah, I mean, it works. The really nice thing about these assessments is it breaks down exactly what people need to know. And it gives them that real tangible idea of, okay, these are the 5 things, right? Or something that you need to study. So a lot of times, you know, a senior might come in and say, I don't know anything about computers, I'm afraid of them. So being able to identify what they do and don't know, their own abilities, was really helpful in guiding that kind of instruction. And then another thing that I did was I worked with volunteers. So I hired maybe 4 volunteers, and they were all retired folks. So I found that really, really helpful to be able to kind of pair them up with the students coming in, because, you know, I have, like, you know, a young face, so people assume I've always had, you know, technology access, but I really did grow up in the middle of the woods. I was homeschooled, and I didn't have access to technology. So, you know, everyone needs this access, regardless of age, but it's definitely possible for seniors to learn these things. Yeah, and I think, I mean, in my experience, the best way for them to learn is with like a one-on-one tutor, kind of someone holding their hand, versus saying like, okay, yeah, you can learn these things online, just Google it, you know. That can give them, you know, a barrier right away, so they won't be able to progress. Yeah.
Thank you. Do you know, have you gotten any feedback from employers, or do you have any anecdotal information as to whether having these certificates is compelling to employers?
Right. So anecdotally, yes. So I've had people in my computer class who like were laid off from their job, and then they got their certificates and were able to get their job back. I've had people in my class who've been able to get promotions using the certificates as proof that they're improving their skills. And we do have employers who are offering the certificate, so companies that are using it to test their employees or people that they're hiring, they'll have them take the tests before they hire them, to kind of see where their computer skills are at and what they're going to need in terms of training. But you know, it still is a pretty new project. It really started in 2012 and has been growing at a very rapid pace. So I think that's going to come more and more. Before this was developed, there wasn't really a basic level computer skills assessment. There have been higher level, you know, Microsoft certification kind of level. But before this, there wasn't something that tested things like whether someone's able to navigate the internet. Mm-hmm.
Yeah. So are the modules free as well?
Mm-hmm. Yeah, so so if you go to our website, just right here, so it's digitalliteracyassessment.org, and you click Take an Assessment, you can take any of these assessments for free. So you can just click on them and open them up.
Yeah, but the modules?
Learning modules. Oh, the learning modules. Right. So the online learning modules aren't developed yet. So those are something that's coming. And likely what will happen is that those will be associated with the testing locations. So they'll be able to set people up for the online learning. So they're free. I don't know whether or not we're going to make them publicly accessible, because that opens up having to support all of those students, which I don't, like our team of 5, I don't think is equipped to do. So we want there to be like an instructor who's helping support students doing that learning online. Yeah. Mm-hmm.
I'm wondering what you pick up from people that you work with in terms of the unstated, but I think very real social bias that our culture has to make people who don't get how to do this right away feel uncool, socially awkward, what have you. I mean, there seems to be such a you know, and part of it I think is generational, part of it of course has to do with socioeconomic factors, but it's like if you grow up with it and you have these skills, it seems like there's a tendency to look down on people that didn't.
Yeah, absolutely. And I think that, I mean, that's real. Like, people do look down on people with low technology skills, and that can prevent people from seeking help with their technology skills because they're ashamed or embarrassed. So I know in my computer lab, I would have people coming in sometimes crying on their first day or shaking, you know, as they're touching a mouse for the first time. So my recommendation, you know, is to have them work with a tutor or teacher to overcome those things. It's almost never helpful to ask like your son for help because he'll just do it for you really fast and not explain it, which is what a lot of people in my classes were having frustrations with. But looking at a tool like this for assessment and guiding instruction, that's really, it's a good way to kind of hold people's hand. Because nobody gets like 0% on the assessments. So right away it's a confidence boost, even if they don't pass, to see these are things that I am able to do. I'm able to kind of use my brain to think through, okay, this is a laptop computer, it fits on a lap. You know, even if that's something that they weren't super conscious of before, they're using their problem solving skills to do that. In my computer lab, working with a lot of folks who were brand new to touching a computer, I would do things like take the mouse and kind of swing it around and say, like, there's nothing you're going to do that's actually going to hurt this unless you actually take a hammer to it. So don't be afraid to kind of play around, make mistakes. It's not going to explode. You're not going to, you know, I can't do something on purpose that's going to destroy it. So you're definitely not going to do it on accident. Yeah, but yeah, you're not born with computer skills. We're giving iPads to 2-year-olds now, so they'll be more savvy, but depending on your background, depending on your age, if you haven't had that access, like that's, removing that shame is a big barrier. Yeah.
In your work with populations with low digital literacy, what tips do you have for those who are designing web pages and writing web content? What is something, like tips that you think off the top of your head that would help these students and learners?
Right, so what ideas do I have for like designing websites or, yeah, for working with people who have lower... Right, well I think some of the things that someone brought up, like the symbols, not knowing what symbols mean, that can be a real area of confusion for folks. I find that having less text is usually better than having more text on a website. When you have higher digital literacy skills, you develop that ability to kind of skim and, you know, see what you need to see on a website. Not having advertisements is a big thing. So a lot of my students would struggle with having, you know, ads on the side. They think, okay, this is part of the lesson that I'm doing. Am I supposed to click on this? So keeping it very clean and non-distracting is huge, yeah, in terms of that kind of design. Yeah.
I just have one, I love that you asked that question because I'm sure a lot of people do who are just consumers of websites. I think having one website for everybody is really difficult. So the first thing that happens when I go to a website is, am I a provider or am I like a patient? And so to have one landing page for patients or one place to go, so that's eliminating at least one of those initial barriers when you're trying to figure out where to go.
So yeah, I like that you said that. So like the landing page, so like on our website for Northstar, the first page that you come to is you can test your digital literacy assessment or you can become a testing location. So those are kind of the two groups that are mostly coming to our website. So something like that, you know, that landing page, exactly. Anything else? Any other questions? Yeah.
Can you address some of your thinking about barriers to even using digital technology, such as some people that aren't literate also have various costs to be able to purchase computers, possible sites they can go to, but they also become very nervous about uploads. There's also those people that are concerned about access to their information when they do not know how to have security devices on their computers and how to keep those uploaded.
Right, so that access to barrier and then that fear, right, of the unknown and the internet. So for folks who have access barriers when it comes to like the cost of technology, or they're homeless. So I definitely see people using libraries a lot. So libraries have become a huge resource for the digital world because they often have those open kind of computer labs that people can come in and do their business and get some support. So librarians are awesome at supporting folks who don't have access to that technology. In Minnesota, we are using a volunteer navigator program. So we have volunteers at many different agencies who are there to kind of work side by side with someone as they're navigating things, like applying for school or applying for jobs or healthcare, anything that they need help with. So that's been another very successful thing for us. And then that question that you had about fear, the only real way to overcome that fear is through education and being able to know what you're uploading, where it's uploading to. You know, if you put this in your email, can everyone on the internet see it? So the only real way to overcome that is by becoming more tech savvy. Yeah. All right, awesome. I think we have time for one more question if anyone has one more. Okay, if not, then you get an extra 2 minutes in your break. Thank you so much.